was preparing the statement for Jermaine to give. I then, after doing that, I thought it was reasonable. If they wanted to change anything and it was legal, Jermaine wanted to change the fact that they had asked the fans to respect their privacy. And he said that wouldn't be a very good idea because the fans are fans. Maybe we should ask the media to respect our privacy. So he got rid of fans and added media privacy. And then I went into him further where he was sitting in the corner, and then I spoke to him again a little bit, and then he asked me where I was from, and I told him I was born in the Caribbean, in Trinidad, because he heard my accent. And I said, anything else I can do for you? And he said, no, the family will try to do their best in this condition. I asked other people, is there anything else I can do around here? And they said, no. I was then tired to say, okay, I'm going to try to make my way home. And I left the hospital.
You spent time with Mrs. Jackson too?
Mrs.?
Yeah.
Oh, yes. Yeah.
Because Jesse Jackson said you should have spent time with the family, giving them comfort in the last hours of their son.
You wouldn't believe how sad it is to sit there and see the news report that comes around, and it's so far from the truth.
Mm-hmm. We realize that.
They said that I left the car, I ran away. I was in the truck with Mr. Jackson trying to help him to survive. I was doing everything I can. And I couldn't take my car with me if I had to help.
Right. You spoke with the doctor, or correct, Detective Porsche.
He had a little
fedora on.
He's the guy. That's the one who.
White-haired guy.
That's the one who spoke to me at the hospital.
Right. Okay. And you provided him with your contact information and an initial statement.
Yeah.
Basically, what you told us.
Yeah.
Obviously, not as in depth. We had tried to get a hold of you several times. It just would go straight to voicemail.
But then your voicemail's filled. I even tried texting you a couple times.
Is this Friday morning?
The same would be that evening.
Oh, the same day?
Yeah, same day.
Thursday evening.
I'll let you know that all morning Friday is when he's talking to me very early in the morning. And so it was my advice to simply leave your phone off, talk to me. I had a busy day. I was running around doing 3 different things, listening to this story. And so I told him to wait and talk to you later.
Okay.
Perfect.
And then I didn't want to be bombarded by the number of people trying to reach me on my cell phone.
Being Michael's on again, off again physician, are you aware of any pre-existing medical conditions that he had? I mean, you talk about him being possibly addicted to these agents, but anything that you're aware of, any problems that he had?
Well, as far as problems that I treated him for a pneumonia.
Okay. When was that?
I think sometime in 2008.
Okay.
2007, 2008, I can't say for sure. I treated him for a fractured toe, a presumed fractured toe. When he was upset in his house, he did for some reason, and he kicked his door in and hurt his feet.
Remember what year?
That I think was 2008. And other than that, I treated him for like upper respiratory viral syndrome, weakness, and a little bit dehydrated state, because he don't eat very well.
Was it kind of chronic with him?
What?
The dehydration and
he don't drink. He don't
fatigue?
drink and eat. He says all his life his mother's had to force him to eat as a child, so he just don't like to eat foods. And the foods that he eats when he eats is those mostly chicken and rice.
What year was it when you treated him for the upper respiratory viral syndrome?
2007, 2008. It was. Oh, you mean the upper respiratory? That was the very first thing I treated him for. That was like a viral illness that was infecting the children and himself, and they were coughing and runny nose and not drinking enough and not getting enough rest.
That'd be about 2006.
Yeah, that was the first time. And I probably treated him a couple of times, maybe 2 or 3 times for that condition.
And then he had some blot on his foot.
Oh, yeah.
But that's probably not what he does.
Well,
I'm sorry, go ahead.
As I looked at his feet over the years, as a dancer, he had calluses that was so deeply engraved in his feet, and it would be so painful when he danced. I got a podiatrist to come to the house, so they did carve out the callus so that his pain went away. But at the same time, while looking at his feet, he had very severe onychomycosis, which is fungal infection that took over every toe and had gone into his flesh.
And when did you notice that?
On my examination.
When was this though? How long ago?
I noticed that initially when I first saw him, and he had his socks off. Within the first year I saw him, I saw that as a condition. And we talked about it. We got his calluses to come off first.
But how long ago? What year? What month? Was it this year? Within the last few months?
No, about, I'd say maybe a year and a half ago.
One of the important things about this, you might want to tell the young man, is before he treated it, he treated it with Lamisil. They do sell it in cream, but the thing is, if you take it orally, it's pretty tough on the liver.
Lamisil?
Lamisil.
So he did a full blood workup on him to make sure his liver and everything was within range. So at least you have that available. It was done on a fake name because it didn't like any of that info getting out.
Right.
But everything was in range, right?
Everything was fine.
Yeah.
And then I gave him the 3 months of the Lamisil, and kept checking with him to make sure that he was complying. But he was very happy. At the end of the 3 months, his infection in the foot, his skin was soft, there was no more exfoliation, no hardness, the nails had grown over new. He was amazed. He was very happy with that.
Yeah. Is there I'm not asking for any trade secrets, but is there any preliminary toxicology at all?
No, not that they've even shared with us.
In the event there's some, since we don't know what's going to show up, so we can feel like the tissue, these 3 drugs are going to show up. Were you aware of any other medications he was taking?
I was not aware of any other medications that he was taking, but I heard that he was seeing a Dr. Klein 3 times a week in Beverly Hills. And he never disclosed that to me.
You heard from who?
His staff, like Frank Delano, Kenny Ortega, different people that work on his production team, that he was seeing him 3 times a week. Right about 3 weeks ago, desperately around noon, he was calling for someone at Dr. Klein's office. He called Brother Amir to call Dr. Klein's office. He wanted to speak to a special person there. I think the name was Jason. I wanted Jason to see if he can squeeze him in, around the other patients.
Is this something Michael told you?
I'm there while he's doing this.
Oh, he's doing it.
Yeah.
Did you ask him what he needed?
That he wasn't disclosing. I mean, that's his own personal preference. He's in charge of his medical history. He never declared it to me before, but I'd seen bottles of pills at his bedside that had Dr. Klein's name on it. I also saw like a Dr. Metzer name on that, so I realized that he's also seeing other physicians. But he does not disclose to me.
I'm going to give you the names of some, I'm going to butcher the names of some medicines, and you can tell me if it's something that you've treated him with.
Yeah.
We've already covered the propofol. Propofol injectable emulsion, 1%. That's
Lidocaine, that's called the anti-burn.
right. The flumazeno.
Flumazeno, that is the antidote that I gave him,
Right, the
0.2, to try to reverse the effects of the benzodiazepines.
All right. The clonazepam. Is that something that you had issued?
Clonazepam, that's what's the other name for that? Is that Restoril? Well, how many milligrams is that?
It is. I don't know.
Yeah,
I just know
I may have prescribed clonazepam, which is Restoril, which is a 30 milligram pill that he should use at night, PRN, if he, as needed, should he wish to sleep.
Okay. Mm-hmm. So that would be for sleep. Okay. Trazodone.
No, I did not prescribe that.
What is it?
Trazodone is basically an antidepressant that may also cause some sedation.
Cause what?
Also may cause sedation, help you to sleep, but it also treats depression.
It's not a MOI, whatever the hell that is.
No, it's not an
MOI.
not an MOI.
It's that first type of antidepressant.
It's called an SSRI. Yeah.
All right, I got a couple more. Just let me take some notes. You have a question in the meantime?
Yeah, but go ahead. I can.
So clonazepam, you may have.
Yeah.
Trazodone, no.
No.
Diazepam?
Yes. I recently prescribed that for him, very first time.
Okay.
Which is Valium.
Right.
And that again was one of the efforts to try to get him off the milk.
Lorazepam?
That's IV. That's the oral form of the IV Ativan. The same thing I'm giving him.
Oh, okay.
Yeah.
Oral
if
form.
the pill does not work, because when you take a medicine by mouth, about 70 to 80% becomes available in the bloodstream because of absorption.
Which says the oral form of
the lorazepam. Remember that Ativan that I was giving?
Oh yeah,
him?
right, Ativan.
Yeah. The fact that it wasn't working orally, I was wondering whether or not if you give it to him IV, he'll have a better constitution of blood, would that help him to sleep. So that's why that came into play.
How about Flomax?
Flomax, I gave that to him.
Okay.
What's that used for?
Mr. Jackson had trouble urinating. He would describe, and again, he never disclosed everything to me. This was late in the course. Over the last few months, he explained to me that when he went to the bathroom, it would take him hours to urinate. You can come in there, he would actually wet himself down, people would leave him there and come back and he still couldn't go to the bathroom. And I said, really, you've had that? I did check his PSA before, which is prostate-specific antigen and being a black male, and it was within range. So I thought that he had benign prostatic hypertrophy, because if it's elevated, you think other things. And so Flomax is a very good medication that will shrink the prostate and allow him to have a proper stream. So that's basically why he started that.
All right, now nystatin cream mixed with some steroid. Is that something that you gave him?
Nystatin?
Nystatin with
If you try alone.
That's the stuff.
I did not give him that.
Okay.
He probably got it from somebody else.
What's that used for?
That is sometimes the nystatin is an antifungal agent. The triamcinolone is a corticosteroid. I don't know if he's having some kind of jock itch or something else is going on.
Like athlete's foot?
Yeah.
Athlete's foot, not necessarily, because that's cleared up.
Oh, okay.
His feet is cleared up. And he does not have any residual athlete's foot or anything like that. So he's using it for something else that I don't know. It could be a jock itch or something like that.
Latanoprost?
What's that?
Latanoprost?
How do you spell it?
Latanoprost. It's an eye drop solution usually used for glaucoma.
Is it what it's called Opcon A?
I don't know. Well, it didn't have any brand name. It just said Latanoprost on
I
it.
don't know. Is it over the counter?
No, it's prescribed.
If it's a prescribed agent, I don't know about that.
Any problems with his eyes?
Exolatin.
What's it?
Exolatin.
Oh, that's somebody else gave him that.
Okay.
Yeah, Zolatin, right?
Whatever.
Yeah. Yeah, sure.
These guys.
Well, that's interesting too, because he never had seen an ophthalmologist. I was trying to
It
take.
came in 3 vials.
Really?
Yeah, 3 glass vials filled with liquid that you could use a dropper or you could use a syringe. But it is a prescribable one, but there wasn't the name of the doctor who prescribed it. So.
Surprise, surprise.
Okay. How about?
Let's talk about that a little bit, because that's again another surprise for me. That's why I don't know exactly all that he has available to him. Mr. Jackson, I scheduled an appointment with Dr. Devan, somebody from UCLA, known to be very good at radio keratotomy surgery for the eyes.